Stroke is the leading cause of disability of adults in the USA. And people with strokes may present with different symptoms. Some of them may present with weakness, but we are interested primarily in the weakness that could be due to the stroke, such as one-sided weakness. That's more in line with the thinking of, is this patient really having a stroke because one side is weak? Not only do we look at weakness in the limbs, upper limb, lower limb, but we also try to see, is the face involved? They complain of unsteadiness, or they have loss of balance. They cannot walk, even though they may be strong, but they could not walk. Another would be loss of vision. If I'm looking at you, if one part of my visual field could not be seen, then that's more in line with vision loss due to stroke. And we look for that. The inability to talk is another important symptom. Some patients can answer telephones, but when they speak with the other person online, they may not be able to complete a sentence, may only be able to say a few words, or may not be able to talk at all. The other probably is slurred speech, and that could be due to weakness of the muscles that are responsible for allowing the person to speak. The other symptom that you should also be aware of is numbness, particularly in one side of the body. People with, as you mentioned, headache. Headache could be a sign of a stroke, particularly severe headaches that happen so suddenly. There are different types of strokes, but this type of headache that we are thinking of when we have severe sudden type of headache is a stroke which is more in line with bleeding in the brain.